Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about why it's so dangerous for a diabetic to have corns and calluses that have bruising or dark brown or blue or purple discoloration underneath the callus or corn itself. Firstly, I'll talk about what a corn or callus really is. All a corn or a callus, and they basically are the same tissue, there's just different names from what location they're at. Corn describing that tissue on the toes, and a callus is usually found underneath the foot. This type of tissue is something called a hyperkeratosis, and what it is it's a natural reaction that the body creates to basically pressure. That pressure comes from both internally, where there's a prominent bone just underneath the skin, and externally, where there's pressure either from the ground if it's on the bottom of the foot, or from the top of the shoe if it's on the tops of the toes, or sometimes the bones get squeezed in between each other between the toes, and that can cause corns that sit in between each toe. Now, when the body gets this pressure, what it essentially does is the skin has a reaction in order to sort of protect itself from this pressure. And its reaction is to basically thicken up the top compressed layer of skin at that area where the pressure is at. It's almost like a sheet of armor that the body forms. Now, unfortunately, that process doesn't necessarily have a shut-off mechanism, and it just continues to keep building and building. And eventually what will happen is that the corn or callus will get so thick and create so much pressure to the normal skin underneath that it will become painful. And when you have a painful corn or a callus, you tend not to continue to place pressure on that area. Your body will shift weight, you'll change the way you walk. If you're wearing a tight shoe, you won't want to wear those shoes anymore that are creating pain like on the tops of the toes in the case of corn. And so because of the pain, you'll do something about that and reduce the pressure externally automatically on your own. Now, when you're a diabetic, unfortunately, you don't quite have that same capability, because most diabetics, up to 70%, have some form of sensation loss. So instead of feeling pain from this thick corn or callus, a diabetic will often feel nothing. And so this pressure is going to continue to build and build underneath until finally the skin that's underneath the corn or callus begins to die. And as it dies, it basically bursts blood vessels. The pressure creates a lot of trauma to the capillaries, and so bleeding starts to develop underneath the corn or callus, and it will turn purple or a brown discoloration or a dark blue, or maybe have little spotty areas like little fine little dots of red underneath the callus tissue deeply within it. Well, the problem is that that's simply a sign of greater problems to come, and that the skin that sits underneath that area eventually dies and forms basically a crater or cavity that we call a wound or an ulcer. Now, because the corn or callus is on top of this, it's not very visible. So when you're diabetic, you can't really feel it, and nor can you really see that you have a wound, other than being able to see the bruising underneath the corn or the callus. And diabetic wounds are particularly problematic because diabetic wounds don't heal as well as other types of wounds because of the nature of diabetes and the way it affects the wound healing process. And diabetic wounds tend to become infected more readily than other types of wounds because of the way diabetes affects the immune system, particularly against bacteria. And so the big issue is that once these wounds develop, the diabetic process allows this to become a much more dangerous situation, where this wound can become a significant crater underneath that corn or callus and nothing's done to address it because you don't really recognize that it's there. And the wound can get very deep and infection can set in, and I often see abscesses underneath these corns and calluses where there's big pockets of pus, and sometimes that infection can get deep enough into bone and start a bone infection, a deep infection that actually can threaten the life or the health of the foot and the leg before it even opens up externally to be able to see that there's a wound there. So it's particularly dangerous for a corn or callus to get to this level. And if you see that if you're diabetic and you see that you have a corn or callus that has discoloration to the tissue, or it's a darker color, looks like there's some bruising or bleeding underneath there, it's very important that you go see a podiatrist right away to have that assessed. It certainly needs to be reduced, that callus tissue needs to be reduced, and the pressure needs to be reduced as well, either externally through modification of padding in shoes or other types of devices that are going to reduce that pressure externally, or by internal means, by having surgery performed to reduce the underlying bone deformity which is causing this pressure point to begin with. If those are done, then the likelihood of a callus or corn turning into a significant wound that could cause a leg amputation is significantly reduced. Well, I hope you enjoyed this video. Please look for more videos on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.